To jump on. Hello, hello, hello. Welcome to Wellness Wednesdays with Dr. Wells. I wanted to welcome you guys to another episode of being here with me. Thank you all so much. You probably hear the dogs in the background. Um, but that's what happened when you got animals and you work from your home office. But I'm just so grateful for each and every one of you. As you all know, this month, in the month of October, we are discussing all things breast cancer awareness. So, women who are watching now or who will be watching, have you had your mammogram this year? If not, get it scheduled. If you're not sure where to start, let's have a conversation and we can get you set up for your mammogram, get you the resources that you need, connected to resources that are made available within the community so that you can get these much needed screenings that could potentially save your life. It's a simple step, and so many women fail to follow through on getting a mammogram. And by the time they get one, if there is something wrong, it is advanced in terms of the stage. So, last week we talked about breast cancer as a whole, and we talked about some statistics. We talked about different types of breast cancer. We talked about risk factors for breast cancer, who's at risk for developing breast cancer. Today, what we're going to do is we're going to spend some time talking about some of the things that you can look for when it comes to for that woman that's doing her annual screening. And as we mentioned last week, anytime you go in for your physical exam, for every woman, a clinical breast exam should be a part of your physical exam. And so if your healthcare provider is not performing that, then we need to ask some questions and we need to make sure that that is being included with the exam. Um, every month, women should be performing their own self breast exam. And I will share on my social media and I'll get her permission. There is a nurse. She was a student of mine and she's an amazing nurse and is doing so much within the community. Nurse Tisha, you can look her up on Instagram. And she does an amazing job at breaking things down, educating the community. She has such a passion for making sure that individuals have everything that they need to take care of themselves. She provides answers to questions that you don't know to ask. She has an amazing video out right now that she recorded and shared on social media, and I'll see if I can find it and tag her in it. But it goes over one of the examples of completing your self breast exam as a woman. And so I'll make sure I find that and share it on my social media platform because I just think it's an amazing way to follow along and actually see what that process looks like. This infographic or this picture that I'm going to show, and again, I'm sorry, Instagram, I will have to put it on the page so that you can go back and look at it, but I will discuss it a little bit and kind of go over some of the things that we want to look for. So, when it comes to breast cancer screening, we know that the mammogram is the best way to pick up on it in terms of getting images and looking within the breast. And then we also have the ultrasound. So, if you find a lump, you're doing your exam every month, and you find something that just not does not seem right, the next step would be for you to reach out to your healthcare provider, either your primary care provider or your GYN, and um, or your GYN, your gynecologist is a GYN. And they can then do a clinical breast exam. And based on their findings, they will then or should order a diagnostic mammogram. And depending on the outcome of that mammogram, then you may or may not have a additional testing, such as a ultrasound or biopsy or MRI or what have you. When you're going for your annual wellness exam or your physical exam for women, as a part of the screening, you should be given a prescription for a screening mammogram. And a screening mammogram is done just as that, just for screening purposes. However, if you have issues, you find something abnormal, you'll get a diagnostic mammogram. So there's some differences there. Okay. So if you have an issue, you're not going to get a screening mammogram. You should be having a diagnostic mammogram because we want to figure out what's going on. So you go and you have this screening done. There's certain things that you're looking for when you are doing your exams every month. We should be so familiar with our bodies that if something is not right, we're able to pick up on it fairly quickly. And so the reason we have you all do these breast exams each month is so that you know what your breasts feel like. And so I'm going to pull up this graphic. Let me see if I can find it. See if I can pull it back up. Give me 1 second. This is my first time doing this, and I got this from Nurse Tisha. She had it on one of her lives, and so I wanted to share it with you all. So let me share the screen really quickly. And it goes over 12 things that we want to look for, or 12 things that you might be able to find when it comes to, well, I don't know if it's going to share it. It may not share it, so I may have to talk about it and then bring it up. There we go. Okay, so I hope you all are able to see this. So it says 12 symptoms of breast cancer, what it can look like and what it can feel like. And if you can imagine an egg carton, for those that are on Instagram, if you can imagine an egg carton, and inside this egg carton, there are 12 lemons. Each of these lemons have different things going on, and I'm going to talk about it, and then I'll upload it onto Instagram. I don't know how to share a live screen on Instagram as of yet. I don't even know if that's a thing, but we'll figure it out. So when you are looking at your breasts, things that we want to look for, or things that could be indicative that there's something going on. And not every time you have something out of the ordinary doesn't mean that it's cancer, but it could be a potential for cancer. So there's 12 symptoms of breast cancer that we look for. And this gives like a really good understanding in picture form of what it looks like. So we have an egg carton, but it's filled with lemons, and each of these lemons has something going on. So one of the things that we look for, or that could be potentially a sign of breast cancer, is thickening of the skin on the breast. So if the skin is pretty smooth and soft, and you notice that there's one area that's thicker, that could be potential, problems, something that we want to get checked out. And for those that are on Facebook, it is on Instagram, I'm sorry. So if you see that, it's a thickened area there. And then dimpling of the skin. Typically, unless you've had some type of surgery or trauma to the breast, you should not have dimpling there. Many times women who have had biopsies or who've had surgery and sometimes piercings may have some dimpling of the breast tissue, but it was either created via surgical means or some type of trauma. But apart from that, we should not notice any dimpling of the skin. Another thing that we look for is crust around the nipples. The nipples should be soft. It shouldn't have any open areas, no drainage, no crusting or anything like that. Next thing we look for is if there's any red or hot areas, which is indicative of inflammation. And we do have breast cancer that presents itself as inflammation, one of the types of breast cancer. If there's any new fluid or leaking from the nipple, unless you are a woman who is lactating, breastfeeding, or you have certain conditions, there shouldn't be, on a normal routine basis, there should not be any drainage or leaking from the nipple. So if you're noticing any new fluid that's coming from the nipple, the color of it could be indicative of, if there's something going on. If there's any skin sores on the skin of the breast outside of any trauma, then we want to look at that. Particularly if the sores are there, but there is no pain. They just kind of look weird. It shouldn't be there. If there's any new bumps that have come up on the breast that have not been there in the past. Growing veins. Some women have more pronounced veins on their body, and particularly the breast. But if there's new veins that just kind of come up out of nowhere, that could be a potential sign of breast cancer. Sunken nipple. So the nipple, which was on the outside, is now inverted and it's beginning to sink. That is a potential problem, and we need to have that looked at. Another one is a new shape or new size. So changing shape or size of the breast. When we look at breasts in and of themselves, typically they're not symmetric. One tends to be bigger than the other, and that's just kind of given. We're not symmetrical. I don't know there's any part of our body that's symmetrical. One hand is always going to be bigger than the other, one eye, and so forth. And so with the breast, we know that they aren't necessarily going to be the same shape and size. However, if it's something new that's occurring, could be a potential problem. Orange peel skin. And so that kind of looks just like the peel of an orange. Whenever that happens, that could be an indication that there is some type of inflammatory process going on. And then any hardened lumps or hard lumps on the breast. So any changes that's happening, and there could be other things that may present themselves for individuals who have breast cancer. But these are some of the common things that we want to be aware of, and some things that we want you all to take note of, okay, as women. Your partners, your husbands, your significant others, what have you, they're touching your body. And they're looking at your body just as you are. And many times our significant others are the ones who can pick up when something has changed within our body, because we look at ourselves just about every day. And so it's easy to miss things that may have changed, but we don't know. Okay. So these are 12 signs or symptoms of breast cancer and what we want to be looking for and what it feels like. And I saw that and I was like, this is a really good picture of what to look for when we are explaining or going over the process of how a woman should complete her breast exam and what to look for. So anytime you find something abnormal, we're going to go and we're going to talk to our doctors, right? We're going to have a conversation with them, our healthcare provider, whether it's a doctor or a nurse practitioner or PA or whomever it may be. But we want to make sure we're having those conversations with them. Again, going back to knowing the family history. Family history is so important in that if you have a family history of breast cancer, then we know we should be screening you a little earlier than we necessarily would someone who does not have a family history of breast cancer. Many women are living with breast cancer and they're living full lives. Things have changed. Research has broadened in terms of the type of treatment that they have for breast cancer. There's ways that women, are able to deal with it and still have full lives. And so I don't want anyone to feel that a breast cancer diagnosis is the end all. It depends on the circumstances. The patient, when they were diagnosed, what type of breast cancer they have, how aggressive it is, and at what stage it was it is when it's found. So typically you have several stages of breast cancer, and it just depends on how aggressive it is and if it has spread to different areas of the body. So typically you have stage 1, 2, 3, or 4. And the higher the stage, the more aggressive and the more involvement has occurred with that type of cancer. So when we're getting in stage 3 and stage 4, usually it has spread to other areas, the lymph nodes, other surrounding tissue, or other organs. And so that's why we stress the importance of screening, monthly screenings, yearly mammograms, to make sure that you're staying on top of any potential problems. After last week's live, I got a couple messages in my inbox, and I had someone who wanted to know what happens if you don't have insurance when you find out that you have a lump. My response to that individual would be reach out to your healthcare provider or someone, and we can help you get connected with breast cancer screening resources. Our community has so many resources available for breast cancer screening. We're in October right now, and a lot of the walks that are being had, those funds are going towards breast cancer research and screening and support for breast cancer survivors and patients who have breast cancer and their families. And so there's resources that are available, but you have to say something. You have to reach out in order to get the assistance or get that help. Another question that I received is, wouldn't it be better to not know that something's going on? And I've had conversations like this several times with patients and some friends. For me personally, if I had something going on that I can do to prevent it from getting worse, I would rather know. That way I can take the steps to figure out what my options are and decide the best option for me. And if it's something that is requires a lumpectomy, doesn't require, any aggressive medication, things of that nature, then you know your options. But what if it is at a higher stage when it's found? There are options. And that's one of the things that I like, is that we have options in terms of treatment. We have options that women can discuss with their families and decide what's best for them. I love being proactive. And so that's why I'm diligent about getting my physical exam every year. I'm diligent about getting my mammogram. I had a conversation with someone back and forth in the chat or in the messenger. Well, I have a family member who, she's healthy and she goes to the doctor every year. She gets her mammograms, and she was diagnosed with cancer. She never smoked, never drank or anything. That's just not fair. And I agree that there are some things that happen that we don't consider to be fair. However, if individuals are educated about what's going on, if they have the support, if they have the resources, and they know their options, then their outcome could be a lot better, as opposed to knowing that there's something going on within your body. And because of fear, because of anxiety, because of not knowing, individuals don't go and get screened or get checked out. And then when they do, it's too late. Let's be proactive about our health. Let's take care of our bodies. We only have one body, and we have to do what we can to make sure that we are living healthy lives. And the way to do that is to, one, pay attention to your body. Two, get screened. Three, if something's not right, make sure you're getting it checked. Follow up with your healthcare provider. There are so many stories, and there was a story that I was reading. I was looking at on social media, young lady who had dealt with cancer. This was her second bout of cancer. And her husband had been married 3 years, a little over 3 years, I believe. And she just recently passed away due to breast cancer. And she went through all of the things that she could, the medications, things of that nature. And in the end, she lost her battle to breast cancer. And each day there are women who are being diagnosed. There are women right now, as we're having this live, who found a lump, who are afraid that it could be cancer. Yes, the fear is real. The fear is there, but get it checked out anyway. It could be nothing. It could be a benign finding. It could be a non-cancerous finding. And so doing what we can to, one, educate our community, make sure you guys have the knowledge and the information that you need to make the best decision for yourself is our goal and our mission. So each Wednesday, anytime I get an opportunity to talk to somebody, you'll find me educating them. You'll find me answering questions, because that's what it's all about. That's why I went into nursing and in the healthcare field over 27 years ago now, almost 28 years ago, because I have such a passion for educating my community, and because of experiences that I had before I became a part of this healthcare community, in this medical community. I wasn't treated well sometimes, and I didn't feel like I had anybody to advocate for me. And so I'm here. I'm going to advocate for you, my family, your friends, my friends, all of us. And I'm going to make sure that you have everything that you need to be able to advocate for yourself. So men, brothers, fathers, husbands, boyfriends, check on the females in your lives, check on the women in your lives, make sure they're getting their mammograms. We as women put our families at the highest level on the totem pole, and we're at the very bottom. It's time that we push the women in our lives up and allow them to take precedence for once. Not that they don't, but I'm just saying, and I'm speaking to the choir, that we have to be selfish when it comes to our health and make sure that we're not neglecting ourselves as women to take care of our families, because at the end of the day, if we're not well, then our family's not being taken care of well. So y'all like how I put that in there? I'm going to go ahead and end tonight. I just want to say thank you all again for being here. We're going to continue our discussion next week on breast cancer awareness. We'll have a different topic to talk about. I did reach out to a few breast care specialists, and so I'm waiting to hear back to see if someone would be available to join us for a live. If they can, that would be great. If not, we'll continue on how we're doing now. But take care of yourselves. Stay safe. Be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Our mission is to help our family, our communities, and our patients create a legacy of good health. Don't forget, we have our grand opening on the 21st from 12 to 4. The address is 452 Osceola Street, Suite 106, Altamont Springs, Florida. Our phone number is 321-306-6755. Our website is Wells legacyhealthandwellness.com. Stay safe and be well. Until next time, take care. Bye.